Hi everyone, so today we are going to learn about norma frontalis. Norma frontalis is basically the frontal view of the skull. So it is roughly oval in shape, which is broader on the upper part. It is broader on this part, the superior part as compared to the lower part. And then it shows the bony support of face. It shows the bony support of the complete face, including the forehead, the orbits, the nasal cavities, and upper and lower jaws. So, it shows the bony support of the complete face, including the foreheads, the orbits, the nasal aperture, and upper and lower jaw. Coming to bones of norma frontalis, so the major bones which we can see in norma frontalis are the frontal bone, this blue colored bone which forms the major part of the upper portion of norma frontalis is the frontal bone. So the frontal bone mainly forms the forehead and the superior and anterior portion of the cranium or the skull vault. The superior here and anterior portion of the cranium and major portion of the forehead is formed by frontal bone. Then coming to paired nasal bones. These are the nasal bones. These are paired bones, one on each side. Then paired maxilla. These are the maxillary bones. These are also present one on each side. Then paired zygomatic bone. These are paired zygomatic bone. And lastly, mandible. So these are the five bones which form the major portion of norma frontalis. Okay, so this is the frontal bone, then paired nasal bone, paired maxilla, paired zygomatic bones, and mandible, which is an unpaired bone. Now, for the convenience of studying the norma frontalis, we can divide it into four portions. First is the forehead, this portion, which is majorly formed by frontal bone. Then second is the orbits or the orbital aperture. Third is the anterior nasal aperture. And lastly, the lower portion of the face. This lower portion of the face will include maxilla and mandible. So, coming to the forehead. So, as we all know, forehead is formed by the frontal bone. It is the major portion of the forehead and superior anterior portion of the skull vault or cranium is formed by frontal bone. The upper part of the frontal bone is curved and smooth. It is smooth and convex, and the lower part it is irregular and interrupted by the orbits and the nasal bone. So during development, there are two separate halves of frontal bones which are joined by frontal suture. But in adults, the frontal suture is completely fused. But sometimes it can be seen in adults, which is called as metopic suture. So the frontal bone, it is a these are this is a single bone which is during development there are two separate halves of the frontal bone which are joined by a frontal suture. But as the development occurs in adults, the frontal suture is completely fused. Then the structures which are present in the upper portion of forehead, the lower portion of the forehead are first is the superciliary arches. So we can see that here it is a curved bony elevation, which is seen above the medial portion of the orbit. This is the medial one third of the orbit. So above this medial portion of the orbit, there is a curved bony elevation which is called as superciliary arch, which are present on both sides. These are the superciliary arches. So these are round, curved, bony elevations above the medial part of the orbit. Then the frontal sinus, these superciliary arches overlies the frontal sinuses. So they are present above the frontal sinuses. They are more prominent in males. Then there is a round elevation at the junction of two superciliary arches. This portion is called as glabella. So a rounded elevation which joins the two superciliary arches in the middle is called as glabella. So the glabella is present just above the frontonasal suture. This is the frontal bone and these are the two nasal bones. So when frontal bone joins the nasal bones, there is a suture which is called as frontonasal suture. So glabella is present above the frontonasal suture. Now the two nasal bones are joined by internasal suture. Where this internasal suture meets the frontonasal suture, this point is called as nasion. Okay, so the features are the superciliary arches. Where these superciliary arches meet, there is a round elevation called glabella, and where the point where the frontonasal suture joins the internasal suture is called as nasion. Then above the superciliary arches, rounded elevations are seen. These are the two rounded elevations, one on each side, which are present above the superciliary arches. They are called as frontal eminence. And one more feature which is remaining in the forehead portion of norma frontalis is this portion. This is the supraorbital notch or foramen. This supraorbital notch or foramen. So it gives the passageway for supraorbital nerves and vessels. Coming to next part of the norma frontalis, which are the orbits or the orbital apertures. So first we will see the boundaries of orbital aperture, how these boundaries of which bones forms the boundaries of orbital aperture, and then we will see what all bones are present within the orbit or the complete structure of the orbit. So the supraorbital margin, this is the supraorbital margin, and as we all can see that the supraorbital margin is formed by frontal bone. At the junction of its medial 1/3 and lateral 2/3. This is the lateral 2/3 portion and this is the medial 1/3 portion. There is presence of supraorbital notch or foramen, as we all have already seen that this supraorbital foramen gives the passageway for supraorbital nerves and vessels. Then infraorbital margin. The infraorbital margin is formed laterally by the zygomatic bone. We know that these are the two paired zygomatic bones. So the lateral portion of the infraorbital margin is formed by zygomatic bone and the medial portion is formed by maxillary bone. These are the maxillary bones. So the medial portion is formed by maxillary bone and laterally it is formed by zygomatic bone. Then medial orbital margin. Medial orbital margin is this whole structure. So above the medial orbital margin is formed by frontal bone. Then below it is formed by lacrimal crest of frontal process of maxilla. So this green colored bone is maxilla and this upward extension of this maxilla is called as the frontal process of maxilla. So the medial boundary of the orbit is formed by frontal bone above and below it is formed by lacrimal crest of frontal process of maxilla. This whole is the frontal process of maxilla and this portion is the lacrimal crest of frontal process of maxilla. So we can say that it is formed by the medial margin of the orbit is formed by frontal bone above and maxillary bone below. The lateral orbital margin is mostly formed by zygomatic bone. So the upward extension of the zygomatic bone is the frontal process of zygomatic bone. So mostly the lateral orbital margin is formed by frontal process of zygomatic bone, and above a small portion, this portion is formed by the frontal bone. That we can see that this is the zygomatic process of frontal bone. So this portion is formed by zygomatic process of frontal bone, and this portion, lower portion, is formed by frontal process of zygomatic bone. And here there is presence of frontozygomatic suture also. The frontal bone and zygomatic bone, they meet here on both sides. So both sides there is presence of frontozygomatic suture. Then coming to walls of the orbit. This is only the margins of the orbit, the outer layer of the orbit, which is upwardly formed by frontal bone. Downwardly, it is formed by, or the lower margin is formed by maxilla and zygomatic bone. The medial margin is formed by maxilla and frontal bone, and the lateral margin is formed by zygomatic and frontal bone. Now, coming to the whole structure of the orbit, the walls of the orbit. So, if we see that inside of this orbit there is presence of a sphenoid bone also, lacrimal bone also. So these bones also take part in the formation of the orbit. So if we talk about the walls of the orbit, so the lateral wall of the orbit, this portion is formed by zygomatic bone. This blue colored bone is the zygomatic bone, and greater wing of sphenoid. So this forms the lateral wall of the orbit, like this, the internal structure of the orbit. Then roof of the orbit. Roof is again, it mainly formed by the frontal bone. This yellow colored bone is the frontal bone. So roof of the orbit is formed by frontal bone and lesser wing of sphenoid, this portion. So this forms the complete roof of the orbit. Coming to medial wall of the orbit. So medial wall is formed by ethmoid bone, lacrimal bone and maxilla. So this is the maxillary bone. This purple colored bone is the maxillary bone. This is the lacrimal bone. This green colored bone, this is the lacrimal bone, and this is the ethmoid bone. So the medial wall is formed by these three bones. And lastly, the floor of the orbit. So the floor is again formed by the maxillary bone, this maxillary bone inside, and this is the maxillary bone and the zygomatic bone. So this whole portion is the floor of the orbit, which is formed by zygomatic bone, the zygomatic bone and maxillary bone. So like this, we can understand the whole structure of the, or the walls of the orbit. So next, we learn about the nasal aperture and nasal bone. So nasal aperture is the pear-shaped aperture or pear-shaped opening, which is also called as pyriform aperture. It is wider below as compared to above, narrower above. The boundaries of pyriform aperture are: above it articulates with the above there is presence of nasal bone, the lower border of nasal bones on both sides, and below the pyriform aperture is formed by nasal notch of maxillary bone on both sides. So these are the nasal notches of maxillary bones, and in the middle these nasal notches join and form a projection which is called as anterior nasal spine. Anterior nasal spine. So these are the two boundaries of nasal aperture. In this portion of the norma frontalis, we learn about the nasal bone and nasal aperture also. So coming to nasal bone, so these are the two nasal bones which are joined in the middle. These nasal bones are paired bones. If we talk about the articulations of the nasal bones, medially, this nasal bone, it joins with the nasal bone of the other side through this suture, which is called as internasal suture. Then laterally, The nasal bones joins the frontal process of maxillary bone. This is the frontal process of maxillary bone on both sides. Superiorly, the nasal bones articulates with the frontal bone through this suture, which is called as frontonasal suture. And inferiorly here, the nasal bones, they articulate with the upper nasal cartilage. Here is a cartilage which is upper nasal cartilage. So the nasal bones are attached with the upper nasal cartilage. Now coming to nasal cavity. If we talk about the boundaries of nasal cavity, so this picture shows clearly what all boundaries are. This whole structure is the nasal cavity. This is the roof, the anterior portion, the floor, and the posterior portion or the posterior portion of the nasal cavity. So the roof of nasal cavity is formed by nasal bone. These are this is the lateral view of the nasal cavity. So this is the nasal bone, then frontal bone. This is the frontal bone, this portion. Then sphenoid bone and ethmoid bone. So this is the ethmoid bone. And lastly, this portion is the sphenoid bone. So the roof of the nasal cavity is formed by nasal bone, the frontal bone, the ethmoid bone, and the sphenoid bone. Coming to floor of the nasal cavity, so it is mainly formed by two bones. First is this one is the posteriorly is the palatine bone, and anteriorly this is the maxillary bone. So the floor of nasal cavity is formed by palatine process of maxillary bone and the palatine bone. Floor is formed by these two bones. The medial wall of the nasal cavity is the nasal septum. So nasal septum is mainly formed by two bones, that is the perpendicular plate of ethmoid bone, as we have already seen that this is the ethmoid bone and this is the perpendicular plate of ethmoid bone and vomer bone. This one, pink colored bone, is the vomer bone. And the septal cartilage. So this portion is the blue colored portion is the septal cartilage. So this nasal septum is formed by perpendicular plate of ethmoid bone, the vomer bone, and septal cartilage. Coming to lateral wall, the lateral wall of the nasal cavity is formed by three projections of the bone, which are the superior, middle, and inferior nasal concave. Superior, middle, and inferior nasal concave. These concave basically increases the surface area of the bone. The lateral wall is again formed by the maxillary bone, the sphenoid bone, and palatine bones. So anteriorly, this is the maxillary bone. Posterior to this, there is presence of sphenoid bone, and there is palatine bone also posteriorly, which takes part in formation of this lateral wall of the nasal aperture. Coming to lower part of the face, so for the convenience of our study, we will study the lower part of the face in three different parts. First is the maxillary bones on both sides, then zygomatic bones, and lastly we'll study about the mandible. So coming to maxilla, most of the features of maxilla we have already seen, but just for the sake of revision, so these are the nasal notches of maxilla, which forms the boundary of nasal aperture. In the middle, these nasal notches forms a projection which is called as anterior nasal spine. Then there is presence of a foramina just below the lower border of the orbits in maxilla is called as infraorbital foramen. The infraorbital foramen gives a passageway for infraorbital nerve and vessels. And then above the incisor teeth there is a depression which is called as incisive fossa. These are the depressions which are called as incisive fossa, and similar depressions are seen above the canine which are called as canine fossa here. So these are mostly the features of maxilla: the uh, nasal notches, the anterior nasal spine, infraorbital foramen, incisive fossa, and the canine fossa on both sides. Then the maxilla basically has four processes, out of which three processes are we can see in norma frontalis. So this is the alveolar process of maxilla, which is responsible for bearing the alveolar sockets or teeth or maxillary teeth. Then this is the zygomatic process of maxilla, this is the frontal process of maxilla, and this is the palatine process of maxilla. So palatine process of maxilla we cannot see in norma frontalis, but other three processes we can see. So the frontal process of maxilla. Medially, it articulates with nasal bone. As we have all seen that here is presence of two nasal bones in between these two frontal processes of maxilla. So medially it articulates with nasal bones, and laterally it articulates with lacrimal bones. Lacrimal bones here in the medial portion of the orbit on both sides. So the zygomatic process of maxilla, obviously it articulates with the zygomatic bone, and zygomatico-maxillary suture is present here and here. And the alveolar process of maxilla, it bears socket for teeth. Then second bone of the lower part of the face is zygomatic bone. It forms the cheek, or it is also called as the cheekbone. It forms the malar prominences of our cheek. It has only one feature, that is a zygomatico maxillary zygomaticofacial foramen. So it is only one feature, that is zygomaticofacial foramen, which allows the passageway of zygomaticofacial nerve. Then coming to mandible. So this is the mandible which forms the lower part of the face. So the upper border of the maxilla, upper border of the mandible, sorry, is the upper border of the mandible is the alveolar arch, which bears the mandibular teeth, and the lower border of the mandible is rounded. Okay, and the middle part of the lower border of the mandible is called as gnathion. So this is the gnathion. This one is the rounded lower border of the mandible, and the middle portion, this point, is called as gnathion. The other surfaces which are present in the body of the mandible are the there is a elevated portion in the middle, elevated line in the middle of the body of the mandible, which is called as mandibular symphysis or symphysis menti. Then here it is there is a bony protuberance in the middle, which is called as mental protuberance, and on both sides of this mental protuberance are two tubercles which are called as mental tubercles. Then there is presence of the foramina just below the premolar teeth, roots of premolar teeth. This is the mental foramen, which gives the passageway for mental nerve or mental branch of mandibular nerve. And from these mental tubercles, posteriorly and upwards, a bony line runs, which is called as the oblique line. It runs towards the anterior border of the ramus of the mandible, from mental tubercle to anterior border of the ramus of the mandible. So this is called as the oblique line. So these are all the features of the mandible. Then coming to sutures which are seen in norma frontalis. First is the internasal suture. As we all know that this is the internasal suture. And on both sides, these are the nasal bones. Then frontonasal suture. This is the frontonasal suture. This one is the frontal bone, and these two are the nasal bones. Where these nasal bones meet the frontal bone, a suture is present which is called as frontonasal suture. Then nasomaxillary suture. On nasomaxillary suture is present here. These are the nasal bones. When it joins the frontal process of maxilla on both sides, This is called as the nasomaxillary suture. As we all can see, this portion, this, where the nasal bones are meeting the frontal process of the maxillary bone, this suture is the nasomaxillary suture. Then lacrimomaxillary suture. Now this frontal process of maxilla, it joins here with the lacrimal bone in this portion. This frontal process of maxilla joins here with the lacrimal bone here. This is called as the lacrimomaxillary suture. Then frontomaxillary suture. This portion of the suture, which is the extension of frontonasal suture, here and here, where the frontal bone joins the frontal process of maxilla on both sides. So this suture are the frontomaxillary suture. Then intermaxillary suture. Intermaxillary suture present here in the midline, which joins the two maxillary bones. Then zygomaticomaxillary suture. Here is the zygomaticomaxillary suture on both sides, which joins the, this is the zygomatic process of maxilla and the zygomatic bone. So these two are joined here, which is the zygomaticomaxillary suture. And then zygomaticofrontal suture. This is the zygomaticofrontal suture, which joins the zygomatic bone and the frontal bone. Or we can say the frontal process of zygomatic bone and zygomatic process of frontal bone. So both of these are joined by zygomaticofrontal suture. So with this, we come to an end to the bony structures of norma frontalis, and the muscle attachments of norma frontalis will be seen in the next video. To watch that video, please subscribe our channel. Thank you.